Hi everyone. I want to talk about a somewhat unknown syndrome called Ehlers syndrome that I have the pleasure of having. It is seemingly more common in people with Ehlers Danlos syndrome, just like so many other things that we EDSers get. So if you don't know what this is, Ehlers syndrome, which is a weird name, but just named off of the doctor who found it. It's where a bone at the base of your skull, right about here, called your styloid process, grows to be too long and or calcifies. And when you have vascular Ehlers syndrome, like I do, that bone ends up compressing your vascular system. So worst case scenario, it could be compressing your carotid artery, then strokes can be a common issue. But for me, it's pressing on my internal jugular vein. So, and unfortunately, it's happening on both sides. 18 months ago, I had surgery on the left side here. You can probably see my fun scar. So I had my styloid process removed on that side, and then they decompressed my jugular vein, which basically is just creating as much space as possible for your jugular vein to be able to have blood flow to your brain, which, hey, we need oxygen and blood flow to our brain. So common symptoms with this are pressure like headaches, like intracranial hypotension. Some people have intracranial hypertension. So for me, that's kind of my biggest symptom. I've been having these pressure headaches, especially headaches like kind of frontal, like in my sinuses. It's kind of like a band here. And also some nerve issues, like the trigeminal nerve goes in these kind of 3 branches here, and I get a lot of pain there as well. It's kind of just something I feel all the time. Sometimes it's worse than others. It's been incredibly debilitating. It started when I was a teenager and just got worse and worse, probably because the bone was compressing my jugular vein more and more. And then another kind of interesting thing that happened during surgery was they found out that my veins and the nerves they could see were all very small, like half the size of, or maybe even a quarter of what they should be. I just remember them telling me as I was coming out of anesthesia, oh, your veins and nerves are like the size of a 12-year-old's, which is kind of weird and probably makes sense because at about 13 I started having these headaches. So maybe I outgrew my vascular system. So there isn't a whole lot they can do when everything's just smaller, but they did everything they could to, or at least they did everything they said they could to widen the vein and create blood flow. Unfortunately, it didn't do what I was hoping it would do. So I'm getting more answers about this now. I'm actually in Denver about to have surgery this coming Monday on the right side to have this styloid removed and this jugular vein decompressed on this side. I'm seeing Dr. Edward Hepworth, who's kind of the top guy in the country for this. He's probably who I should have seen the first time around. I did really like my other surgeon. He just unfortunately, with his skills, this is still a really new thing that surgeons are kind of figuring out on their own if they decide to go down this path of learning how to treat this. So, mistakes get made even with the best surgeons. So unfortunately for me, I found out today, they didn't take out the entire styloid, so there's like a little bit left, and it can actually grow back. So ideally you want to have the whole thing removed. That's kind of an issue. So there's still a compression happening like up in the upper area and then lower, because they really only address this kind of area here. So I was told, sadly, I will have to have a revision surgery of this side, but for now, they want to operate on the right because it's more of an issue. And also, the other thing that happens with this condition quite often is CSF leaks in the sinuses. Some of you zebras out there may know about CSF leaks in the spine that are really common for us just because our connective tissue is so fragile there, especially if you've had like an epidural or a spinal tap or something like that. I went down that path initially because I thought that was the issue. Had some blood patches, didn't get better. So the way Dr. Hepworth described this to me, which totally makes sense, is your vascular system is being compressed, so your blood and oxygen supply to your brain are being cut off and impinged, basically, kind of like a nerve impingement, but of your vein. So it creates this pressure, which is what I feel. It's like, I just sometimes when I'm having like 10 out of 10 pain, I just want to drill a hole in my head to relieve the pressure. So he did a CT of my sinuses with and without contrast, as well as my neck, which is where you could see it's a CT angiovenogram where they can see your vascular system. And then they also do a jugular vein ultrasound velocity study. So they're basically looking at like the in and out flow of blood. And they can see exactly what areas are being compressed, so they know what to address during surgery. So my sinus CT showed that there's some like thinning and like a hole and some potential fluid buildup. So basically what happens is you've had this pressure in your head and it's looking for somewhere to go, and so it creates holes, unfortunately, in your sinuses. So it kind of makes sense that my pain is like here. I even had sinus surgery. The ENT, no clue about this. Didn't see it in my imaging. I mean, I'm just turned 40 a couple months ago, and I started having this pain when I was 13. So it's been a long road. I wasn't even diagnosed with EDS until 2020, and that's kind of when I really started to figure things out, and one thing got figured out after another, and mast cell activation syndrome, which I know all you zebras know about, POTS, and all that. So for those of you out there who are experiencing pressure lake headaches, nasal drainage, that's a sign of a CSF leak, because it's often CSF is coming out of your nose, especially like if you bend down. That happens to me all the time. And dizziness, vertigo, trouble swallowing, pain swallowing, sore throats. Like I get really hoarse if I talk a lot or talk in loud spaces. It can also contribute to nerve issues in your face. So those are all symptoms that I've had and no one had been able to figure out until recently. It was actually a chiropractor who figured it out and referred me to all these doctors. So thank you, Dr. Steve Wagner. You're the best. So yeah, I just wanted to share this all with you because my goal really, I feel like the best thing to come out of what I've had to go through, which has been really, really hard over the years, is that if my experience in any way can help anyone else, it's worth it to me. So that's kind of my passion now and my goal in life. And unfortunately, it's been a struggle to go down this path of being a healer. I was in grad school for counseling and just couldn't keep going because my symptoms got so much worse. So, yeah, I just wanted to share this and be open about my experience in case it helps you. And I will continue to post updates on my surgery and more videos about other EDS-related conditions in the future. So sending you all gentle hugs.